What is the Alabama Breast and Cervical Cancer Early Detection Program? The Alabama Breast and Cervical Cancer Early Detection Program, ABCC-EDP, but referred to by many as ABC, cares about women in Alabama being able to receive the health care they need, especially breast and cervical cancer screenings. That's why ABC was created, to give all Alabama women access to the life-saving cancer screenings they need. Started 25 years ago as part of the National Breast and Cervical Cancer Early Detection Program, ABC offers free breast and cervical cancer screening, diagnosis, and treatment to low-income, uninsured, and underinsured women across the state. ABC can also connect women who may not qualify for our program to partners who can help. We have regional coordinators that can help any woman get connected and receive the care she needs. All states have a breast and cervical cancer screening program that is funded by the CDC, and in the last 2 decades, they have succeeded in screening millions of women, many of whom have never been screened or rarely screened. They have diagnosed tens of thousands of cancers and precancers. Alabama is an important part of this success story. First begun in 1996, ABC has grown into a network of hundreds of providers and clinics who serve women in every county, and we're still growing. Clinics have worked with ABC for years, and together they have screened over 200,000 women for cancer who couldn't afford it otherwise. It's a program that helps keep women alive. That is what ABC is all about, detecting cancer early and saving lives. Look at the toll breast cancer takes. 1 in 8 women in the U.S. will develop the disease in her lifetime. In Alabama, over 4,200 women are diagnosed with breast cancer each year, and over 730 lose their lives. For cervical cancer, Alabama is consistently in the top 3 in the nation for cervical cancer diagnosis and death, and are significantly higher than the nation. Over 240 women are diagnosed each year, and over 30 women lose their lives due to cervical cancer. What we know is breast and cervical cancer are not equal opportunity killers. In Alabama, Black women are more likely to be diagnosed and die from breast and cervical cancer than white women. Race can determine whether women live or die. Also, women in rural areas are more likely to die from these cancers than women in urban areas. Finally, women without health insurance are more likely than their insured counterparts to be diagnosed with late-stage breast and cervical cancer. What explains this health disparity? It's straightforward. Women are more likely to be diagnosed with late-stage cancers when they lack the support they need. Without good health insurance, without money, without social supports, mammograms and Pap tests with HPV co-testing might be out of reach. ABC seeks to bring the life-saving promise of early detection to all underserved women. The program also does much more than just cover screenings and diagnostic follow-up services. We also help clinics improve their care processes and outreach strategies so they can help even more women. More ABC providers increases access to care for our underserved women, especially in rural areas.
Women of all ages and races are seen in our clinics every day. Many patients tell me that they have put off mammogram and Pap smear screening due to not having any insurance or ability to afford to see a provider. The ABC program is so vital because it provides unbiased access to care for breast and cervical cancer screenings. It often saddens me when I see a patient for the first time in her 50s or 60s and learn she's never had a mammogram, or a patient that her last Pap screening was done more than 10 years ago during her last pregnancy.
This is the ABC program story. In 25 years, we've built an amazing network of partner clinics helping to keep women healthy. By working together to implement the latest evidence-based strategies, we're moving toward the day when all women's lives will be equally valued, when all women can be healthy and thrive. Will you join us? We'd love to have you. If your clinic would like to sign on as an ABC partner, we're here to give you a warm welcome. To learn how to work with us, see the other video modules in this series. To begin a contract partner agreement, call the ABC hotline at 1-877-252-3324.